What is Kangaroo Care? Kangaroo Care is also known as skin-to-skin holding. Kangaroo Care means holding your diapered baby on your bare chest. Hospitals all over the world encourage parents to participate in Kangaroo Care. Benefits of Kangaroo Care. For babies, it helps them gain weight, maintain a healthy body temperature, it relaxes their heart rate and their breathing, it helps them achieve quality sleep, which can help brain development, and it helps them develop their sense of smell, touch, and hearing. For parents, it reduces your stress level by stimulating production of hormones. It can help you produce more breast milk. If breastfeeding is your goal, Kangaroo Care helps set the foundation for successful breastfeeding. And then, of course, it also helps you bond with and feel close to your baby. Before you hold, your nurse will pull the curtain for privacy and provide you with a Zac wrap and ensure you have the right size. Sizes range from extra extra small to 4X and are very stretchy. Your nurse and respiratory therapist will then complete a safety timeout checklist with you. In the timeout safety checklist, your nurse will make sure that your baby's breathing tube is in the right position with the respiratory therapist. They'll make sure the doctor has given permission to Kangaroo. They'll ask if you have used the restroom and/or pumped beforehand. They'll ask if you can be away from your phone while you Kangaroo. They'll ask that you can commit to Kangaroo for at least 1 hour. And they'll ask if you can keep both of your hands on your baby at all times during Kangaroo Care. Your nurse will provide you with your Zac wrap. Make sure it goes around your back with the zippers in the front, and the zipper should go from the bottom to the top. It should be snug, but not too tight.
So before we do the kangaroo hold, we're gonna do a timeout first. So we have baby Susie here. We have our RT, our nurse, and our mom. We're gonna check the tube placement before we put her on your chest. Perfect, 6 at the lip. And then I already checked the computer. There is an order that you can kangaroo. I know you just watched the video and you have your rep. So, just a few questions. Have you used the restroom and pumped?
Yes, I have.
Perfect. Can you be away from your phone for the whole time? Okay. Can you commit to kangarooing for at least 1 hour?
Yes.
Perfect. And are you able to keep one of your hands on the back of her head at all times?
Yes.
All right, we can go.
After the timeout, your nurse will grab another nurse helper and the respiratory therapist, and the 3 of them will get your baby ready to go. They will suction your baby's breathing tube, unwrap them from their swaddle, and change their diaper to ensure they're comfortable and can stay on your chest for a long time. When everyone's ready to go, the respiratory therapist will briefly disconnect your baby's breathing tube, and the team will place the baby on your chest. Your baby's head will be facing the ventilator machine. The respiratory therapist will reconnect and secure the breathing tube either to the Zac wrap or to a blanket draped over your shoulder. This ensures the breathing tube does not move while you are holding your baby. Your nurse will zip up the Zac wrap all the way up to your baby's ears and ensure that you are comfortable, your baby's comfortable, and everything is in a safe position. Your nurse will place a pillow under each of your arms to ensure you don't get tired while you're holding your baby. If you'd like, you can also have your feet up, and your nurse can lean back the chair. It's important that you don't use your cell phone while you're holding your baby. But if you'd like to document this moment, please ask your nurse and they'll take pictures for you and even a short video if you'd like. A mirror is available to help you see your baby's face during Kangaroo Care. If you need to adjust yourself in the chair, please let your nurse or respiratory therapist know and they will help you do so safely. At least every 30 minutes, your nurse or respiratory therapist will come by and check on your baby's breathing tube placement. They'll also check to make sure you're comfortable and that your baby is staying nice and warm. Once it's time to put your baby back in the bed, the team will reassemble. Your nurse will have you lean slightly forward to the best of your ability to assist in the transfer to their hands. Your nurse will unzip the Zac wrap, and the respiratory therapist will undo the securement devices. Again, your respiratory therapist will briefly disconnect the breathing tube, and once your baby is back in the bed, everything will be reconnected, and we will ensure that your baby is warm and comfortable. It is very important that you keep both hands on your baby during kangaroo care to ensure that your baby stays comfortable and moves their head as little as possible. Our goals are to keep your baby's breathing tube safe and allow you to kangaroo as long as possible. Enjoy the experience. Sing and talk to your baby during kangaroo care. Your baby loves to hear your voice and feel your skin. Ask your nurse to take pictures with your phone. Once your baby's breathing tube is removed, also known as being extubated, please continue to hold your baby skin to skin. Kangaroo care after your baby is extubated is an exciting milestone in your NICU journey. Thank you for watching. Your baby's nurse and respiratory therapist will review the timeout safety checklist with you before you hold your baby.